Hi, I'm Dr. Catherine O'Neill. I'm an Associate Professor of Clinical Medicine with LSU and the Chief Medical Officer at Our Lady of the Lake Regional Medical Center. I'm here to talk to you today about communicable diseases, what they can do to our community and our facilities, and how we can best put together a plan to combat those as we see them. First, what is a communicable disease? It is a disease that's spread from human to human, or sometimes from animal to human. We have encountered many communicable diseases throughout the history of our society. The most common we see every year, which is the flu or RSV. Some uncommon communicable diseases have been polio or the plague or even Ebola. And each one of these, we have to develop our own strategy on how to keep our patients safe, and how to keep our families safe, how to keep our healthcare workers safe. When we do that, we are developing a disaster management plan. And today we'll walk you through the different steps of a disaster management plan, most importantly, mitigation, preparedness, response, and recovery. And as we go through these stages, we'll give you some keys and some clues that will help you prepare for the next communicable disease that our community sees.
We'll now discuss mitigating the risk of communicable diseases with a focus on prevention.
I'm Chiquita Ferguson, an epidemiologist at Louisiana State University's Health Science Center School of Public Health. I'm here to speak to you about prevention. Prevention is key. In terms of risk assessment, we must be prepared, we must be ready, we must do things in advance. We have to know and understand each patient's degree of vulnerability, frailty, and comorbidities. Some of this can be done ahead of time, but if an emergency arises, we have to re-evaluate it, we have to review it, and we have to understand to identify who's most at risk. In addition, in advance, we should have available vaccinations and boosters. All of our patients and residents should be up to date in terms of their vaccinations and also have available new vaccinations and boosters as they become ready. We should have a well supply at your facility for all residents, patients, and staff members. Also, continuing education is a great part for prevention. People must understand and know the risk, understand the current and immediate needs, and then understand new policies and procedures as they're rolled out. Communication is a great key to prevention.
Stage 2 after mitigation is preparedness.
Let's talk about preparedness for a little bit. The most important thing that you can have in your back pocket in order to be prepared for the next potential communicable disease outbreak is a preparedness plan. It sounds so simple, but it's actually a little bit complicated. A preparedness plan should be reviewed every year. You shouldn't make one yourself. Great plans are available through FEMA, through CDC, through some of our epidemiology societies, through Joint Commission. These organizations have made it their job to help us protect each other. You should take that plan, it's usually a checklist, and every year you should go through it and say, did the last hurricane damage our PPE? Do we have enough staff this year? Because there's always a staffing shortage. Or are we ready for that thing we heard about in the news just a month ago? And so each year, as you go through that checklist, you may make some adjustments, but in the end, that checklist will be your guide to make sure that whatever you have to face, you're ready. Some of the most important things in a disaster preparedness plan are going to be PPE supplies, staff education, rooms that you can separate patients from other patients who are not sick, and most importantly, the ability to screen anybody coming into your facility and the ability to notify people as they leave your facility of an exposure. Those things will be assessed each year through your plan, but you should always have those in mind should you encounter something that is new to you and a little bit scary. Take out that plan and use it.
We're now going to talk about the importance of response after an outbreak of a communicable disease.
Hi, I'm Dr. Joe Kander, State Health Officer for the state of Louisiana. We've had our share of emergencies over the years, and we've learned some lessons from that. Number one, in my mind, is that vulnerable people are vulnerable, and we need to do extra care on the front end to help vulnerable people survive emergencies. We need to recognize who they are, what their particular needs are, and take action ahead of time so that people that have extra vulnerability do okay. during emergencies. Many of these individuals live in your facilities. We need to take action quickly regarding the comprehensive and established emergency response plan. And we need to pay particular attention to communication, particularly open and honest communication with residents, family members, and staff in order to foster trust. I can't say how important that is enough. If people don't trust one another during an emergency, things don't go very well. We need to make available resources for counseling. We know how stressful these situations can be, both during the event and after the event. We also need to focus on social isolation. Many of your residents feel isolated, don't have a lot of support networks. We need to take that into account, particularly during emergencies. We don't want to wait for decline in a particular individual before we address those types of changes. We should look for changes in sleep habits, weight loss, appetite change, mental status changes and dementia, mood changes, and care compliance. If we look out for all of those things, we'll be able to recognize these declines as quickly as possible and address them both during an event and in the immediate aftermath.
Our last stage is recovery.
My name is Jocelyn Mancuso, and I'm an occupational therapist at Our Lady of the Lake Regional Medical Center in Baton Rouge, and I'm here to discuss the recovery process from COVID. For some, recovering from COVID may last weeks to months following their hospital admissions. Patients may experience symptoms such as continued shortness of breath, fatigue, muscle weakness, mental health or cognitive disruptions, or brain fog. This is specifically known as COVID long haulers. Occupational and physical therapy are vital when combating these symptoms during the hospital admission and during the recovery process, either at home or in post-acute settings, to improve full body strength and endurance. Deep breathing exercises and energy conservation techniques can be used while at rest, during therapeutic exercises, or when completing daily activities such as getting dressed, cooking a meal, or ambulating down the hallway to the bathroom to brush teeth or take a shower.
For more information regarding nursing homes and the impact of COVID-19, please visit the Louisiana Department of Health at ldh.la.gov or the Centers for Medicare and Medicaid at cms.gov.